Hello, my name is Art Guzman. I'd like to welcome you to the simulation department here at Burrell College of Osteopathic Medicine. I am the director of the program here, and this is where students get the opportunity to practice their skills that they've learned in the classroom. Anything from CPR, we have task trainers just specifically for that, and going to the other side of the spectrum to our high fidelity mannequins that we offer here at Burrell for students to actually be in lifelike situations, whether these are scenarios that are built in from the machine or we actually create those scenarios for the students, giving them that opportunity to practice as close as realistically possible a scenario. They may come in as teams, they may come in as individuals. For instance, here in the back here we have a birthing mannequin. It's part of the Gamard product. It's a full delivery mannequin where students get the opportunity to practice deliveries. Other mannequins that we offer here as well are adult mannequins as well. We have pediatric mannequins as well that offer that as well too. We offer students an environment here of learning. We want them to practice and come in and utilize this equipment so that prepares them for them to come in, or as they prepare to get ready to go into the hospital settings where they will actually be performing a lot of these skills on actual life patients. So we want them to practice. This environment is secure, this is safe, and this gives them the opportunity to develop and move forward as they move through their education. Our mannequins here, especially the high fidelity mannequins, are capable of producing any scenario that we would like to produce for the students for them to practice and to run through. Say for instance, an example of that could be running through an advanced cardiac life support scenario where a patient is demonstrating signs and symptoms of a heart attack, and that patient may or may not go into an actual cardiac arrest where students have to perform through their ACLS protocols and algorithms and so forth, and attempt a resuscitation using team dynamics. The mannequin that we have back here in the back, which also too is a mannequin that can be programmed as well for deliveries, normal or abnormal deliveries, depending on what is asked for of the mannequins to do. So once again, the mannequins are capable of producing any lifelike scenario for the student. Is once again a controlled environment, so students have the opportunity to pause and stop and learn. Now, task trainers are available for the students as well. So say for instance, if a student just wants to practice airway maneuvers, a basic or advanced airway, the students have the capability of using just that particular task trainer that provides the anatomy, so students can actually visualize and actually perform the actual skill of, say for instance, endotracheal intubation if we want to use that. We have mannequins here also too that are capable just for CPR. So if a student wants to practice CPR skills, their AED skills as well too, we have those task trainers here that are just specific to doing that. So we don't always necessarily have to use an extremely high fidelity mannequin, because if the student is just interested in a particular skill, we can bring out those task trainers and the students can certainly use those. The overall goal is to have our students prepared and ready to go into their field rotations, and also as they move forward in their careers as well.